Welcome back to Therapeutics. In this brief block, we're going to go through management of pulmonary hypertension, which is frankly mostly managed by pulmonologists and not usually by general providers, but you want to be aware of certainly the drugs that are used when you see patients come in on them. We'll talk a little bit about pulmonary hypertension. All right, the last little block here is pulmonary hypertension, and the treatments of choice for pulmonary hypertension are different. Typically, the first-line therapies are often one of the vasodilators, and these evolve over time. Historically, the first agent that was widely available here was Flolan, and we still use Flolan, but it has to be given intravenously. It's only available by a certain limited use with a certain type of infusion pump. It's not easy to do, but it's a direct vasodilator or arterial vascular bed, so it works quite well. More commonly, we're going to see one of these other vasodilating agents used for pulmonary hypertension chronically. We have bosentan, or the other one we'll see used quite a bit is sildenafil, which is the same active ingredient as Viagra. It's a phosphodiesterase inhibitor in the lungs, causing vasodilation there. There are some bunch of tables here that I encourage you to look at, some initial treatment with supportive care and with vasoreactive disease and who are candidates for what. Sometimes we'll look at for vasoreactive pulmonary artery hypertension, you'll see sometimes an oral calcium channel blocker used and evaluate that as a first-line therapy in those circumstances. If you've ruled out vasoreactive diseases, based on the World Health Organization's schema of recommendations they'll have is they'll start with one of the vasodilators, as we alluded to already, and go from there. After you've ruled out vasoreactive diseases, there's a table here that will list which other agents are sort of considerations and what their doses are and some considerations you have in therapy. Most often when you have someone with pulmonary artery hypertension, typically these are folks who are going to be managed by the pulmonologist. And primary care practice, you're probably continuing therapy rather than initiating therapy. More sort of list of drugs and specific, and more list of drugs and specific.